Hello, everyone. My name is Watisha Buckles, and today I'll be presenting key legal risk reduction and safe practice strategies for new family nurse practitioners. My focus is on Tennessee regulations, evidence-based practice, and the practical tools we can use to protect our patients and ourselves as we transition into independent practice. So, the purpose of this presentation is to help new FNPs understand the legal and regulatory expectations that guide safe practice. Legal awareness is essential because most malpractice cases stem from preventable issues like communication gaps, documentation errors, or practicing outside of its scope. Much of the framework that I'll reference comes from Butaro et al. 2025, which emphasizes evidence based collaborative primary care. In Tennessee, APRNs practice in a restricted practice environment. So this means we must maintain a written collaborative agreement with a supervising physician. To prescribe, we need a certificate of fitness, and controlled substance requires a DEA number and compliance with Tennessee's opioid prescribing laws. Understanding these requirements is essential to staying within scope and avoiding disciplinary action. So now I'm going to touch on Tennessee's telehealth regulations. So Tennessee does allow APRNs to provide telehealth services, but we must establish a valid provider-patient relationship and hold Tennessee licensure to treat Tennessee patients. Controlled substances have additional restrictions, and documentation must be as thorough as an inpatient visit. So telehealth expands access, but it also increases liability if documentation or follow-up is incomplete. So Butaro et al. Reminds us that documentation, consent, and clinical reasoning must be just as thorough as inpatient care. Now, let's go over the 7 C's. So the 7 C's of malpractice prevention provide a simple but powerful framework for reducing liability. These include care, communication, consent, competence, charting, confidentiality, and consultation. Each one plays a critical role in safe, high quality practice. So, to break it down, care means providing timely, appropriate, and evidence based treatment. Communication, clear communication prevents misunderstandings and it improves outcomes. Consent, consent is a process, not just a signature. So when you go into the bedside or when you're meeting with the patients in the exam room, before you have them sign this consent, you need to take out the time, explain the risk and the benefits to them. Make sure that they do or don't have any questions about what you just explained to them before you have them signing anything. And then there's competence. So stay within your training and seek help when needed. Familiarize yourself with your state practice um, regulations. Know what's within your scope. That way you don't have to be in court explaining yourself. Charting. If it isn't documented, it didn't happen. So again, make sure you're charting your telehealth visits. Document that when you have a patient to consent for something, document that you explain the risk and the benefits to the patient. Document how the conversation went. And then there's confidentiality. Protect patient information at all times, especially if you're going to be texting, make sure that it's through a secure server. If you're chatting, for example, I know my current employer, we use EMR known as Epic. So Epic allows us to send secure chats from the patient's chart among providers and other healthcare workers. And then there's consultation. Know when to call for help. So don't be afraid to send a referral for a patient. If a patient comes into your clinic and you're doing their annual physical exam, so you get all their labs, you get their EKG and their chest X-ray. So then the EKG it comes back and you can't just make out exactly what it is, but you know that there's something off with that EKG, and the patient may be showing some symptoms, but you're not sure exactly what this diagnosis could be. Don't be afraid to consult the cardiologist. So, next, I am discussing some common liability risk and mitigation strategies. So, common liability risks for NPs, FNPs include diagnostic errors, prescribing mistakes, failure to refer, poor documentation, and inadequate follow up. These are the areas where malpractice claims most often occur, and they're also the areas where strong systems and habits can dramatically reduce risk. Now, I'm going to touch on risk reduction strategies. To reduce risk, I plan to consistently use evidence based tools, document thoroughly, and use the teach back method to confirm patient understanding. I'll consult early when cases are complex, provide clear return precautions, and check the Tennessee Controlled Substance Monitoring Database before prescribing controlled substances. And these strategies align with best practices outlined again in my reference, Botaro et al. 2025. My personal transition plan includes safe prescribing habits, structured documentation, and regular mentorship with my collaborating physician. I plan to carry individual malpractice insurance to ensure personal protection. I also plan to stay updated on Tennessee's regulations and complete ongoing and continuing education, especially in pharmacology and controlled substances. In conclusion, safe practice is built on evidence based care, strong communication, and thorough documentation. Understanding Tennessee's regulations and staying within my scope of practice are essential for legal protection. So, lifelong learning is one of the best ways to protect both our patients and ourselves. Thank you for listening. This concludes my presentation.